Hey guys, it's Dr. Emil Tompkins, and today we're going to be talking about your diet and your mental health.
You are listening to the Beyond the Pain podcast, where Dr. Emil Tompkins and his guests guide you through the latest techniques to relieve your pain and learn how to fuel, move, and think for lifetime wellness.
All right, thanks for joining us. This is Dr. Emil Tompkins from the Beyond Pain Relief podcast, where we're committed to helping you to live a life that is free of pain, but also experiencing your ultimate goals in health and wellness. So, in 1847, a physician named Ignaz Semmelweis suggested to his physician friends that he has been researching and realized that he has figured out what's been causing septicemia in newborn mothers. Moms would have babies and they would die of an infection. He figured out what the cause was. So his research showed that a small non-medical sep can decrease the likelihood of this septicemia from 18% to 2%. All doctors had to do was wash their hands in a specific substance that helped to clean germs. The birthing clinics at the time had death rates of mothers of newborns. They were 3 times higher than in locations where, say, midwives helped labor and delivery, which is the family's home. Today, 250 years later, we realize that this was a fact that was true, but at the time was severely rejected by the medical community. They could not accept that they were the cause of death of these mothers. Semmelweis was ridiculed, dismissed, over time was broken down and ended up dying from, of all things, septicemia in an asylum. When something has been proven by science, it is different than, say, what the scientific norm is. It gets shut down. It gets buried, even though it can better help the patient. And if we're going to improve the lives and health of people in the future, we have to be open and willing to embrace advances, embrace things that might be letting go of what we've always done, if it means it's going to provide a better life for the people around us. Today, one of these treatments that are really effective for people when it comes to their mental health, and it's something that's been kind of bashed for a long time because it's said that the only thing that really seems to help are some very powerful medications, but it's been shown that nutrition can have a difference in our mental health, and we're going to talk about that. Mental health challenges right now are rapidly rising. The rates of depression are on the rise in America. In the past 20 years, the American College of Psychology says that depression has risen over 125%. By the year 2020, depression would have risen to be the second most prevalent medical condition in the world. Amazing how bad this is getting. The rate of ADHD in children is increasing rapidly over the years. In fact, in the last 8 years, there's been about a 43% increase in ADHD diagnosis. And at first glance, the treatment for these conditions can be super effective. For example, Ritalin is an incredibly effective medication upon initial dosage for children with ADHD. Children show promising signs early in their attention and their behavior. However, when you look long-term, these treatments don't seem to show the same result. Actually, many children fare worse long-term than those with the diagnosis that never had medical treatment at all. Despite the increasing use of antidepressants, the long-term studies show that in many cases we're no better now than those who never were on antidepressants. Now, I'm not saying here that no one should take these medications, but gosh, there may be another way forward that's not easy, but the outcomes have been shown to be really good. If the medications are allowing us a false sense of security leading to eventual poorer outcomes, then what can we do to improve our situations? Maybe we have to think like our outcast physician friend that saved millions of lives, Dr. Semmelweis. The area we need to focus on is nutrition. We need to understand that our diets are having an effect on our mental health, and we need to understand that right away. But we should also realize that what we're currently eating, the standard American diet, there's not one single study that shows that the standard American diet is linked to mental health in a positive way, at least. And if that's the case, we know we need to make changes. If we do what everyone else does, we're going to get what everyone else gets. And And I know that you don't want that. We have to do something different. So guys, we know what we're doing isn't working. So we need to begin and continue to make decisions and changes that are going to improve your mental and overall health. There's been some really promising research recently. Some Canadian researchers were studying different nutrients on behavioral health and found some really promising information. In 8 weeks, twice as many people responded positively to nutrients, specific nutrients, compared to placebo. Those who were using these nutrients had less negative effects socially than using a placebo. So seeing that, you should now start to see the connection between our diet and mental health. We're seeing a change just by using certain nutrients over a period of time. This was an 8-week study. So it's not something that you take a vitamin and you watch yourself for 2 or 3 days and see what happens. That's not how it works. This was an 8-week study. You have to change your diet in a way that gives your body an opportunity to experience that change. And then we start to see a result. Now we're going to talk about during this podcast one specific nutrient that has shown some really good promise when it comes to helping your brain function, and that's omega-3 fatty acids. Fish oil is one of the most widely used supplements, one of the most widely studied supplements, shown to have an effect on the brain and mental and emotional function. The omega-3 fatty acids, EPA and DHA, are really important to the optimal function of the brain. And here's why. It's that the DHA that makes up a large portion of the gray matter inside the brain. The DHA and EPA promote healthy blood flow, which is essential to optimum brain function. These fatty acids are major building blocks for the membranes, the cell structures that are vital for our cells to function. The membrane, the outer covering that allows things, nutrients in and out. The EPA and DHA are the source for those membranes. It's crucial for those membranes to perform at their best. Our nerve cells, and especially the connections that they make, need to be rich in the omega-3 fatty acids. So think of omega-3s as, say, a high-quality motor oil for this finely tuned engine that is our brain. And if you need a little more convincing, take note, there's a growing body of scientific evidence that indicates that EPA and DHA-rich fish oil helps to elevate mood. There's a 20-year study involving 3,317 men and women found that people with the highest consumption of EPA and DHA were less likely to have mood challenges. Also, a number of studies points to a connection between the consumption of fish that are rich in omega-3 fatty acids. The people that consume the fish high in omega-3 fatty acids have a healthier cognitive function. There's a May of 1999 study reported a study of fish oil and 30 bipolar patients. 64% of those who took 10 grams of fish oil per day. Now that's a lot of fish oil, guys. That'll probably put you in the bathroom for a little bit. But 10 grams of fish oil per day for 4 months reported a marked improvement in their symptoms. By contrast, only 19% of those who received a placebo, and we don't know what that placebo was, 19% of those receiving a placebo benefited. 64% of people that received 10 grams of fish oil benefited. Joseph Hibeln, a psychiatrist from the National Institutes of Health, has been known to say that he feels that omega-3s just might explain why the rate of depression is rising in the U.S. And here's the thought. You know, for a long time, we've had this health conscious idea that we need to get rid of from our diets saturated fat. We need to get rid of cholesterol. People are eating less red meat, less eggs, two good sources of omega-3 fatty acids. We've been switching to these polyunsaturated fats, things like corn oil, sunbean oil, sunflower oils, things that are relatively low in those omega-3 fatty acids. So we have these fatty acids, we're decreasing our consumption of the really good ones, the omega-3s, and in decreasing the consumption of the omega-3 fatty acids, over time, we're starting to see change. And unfortunately, over time, we're seeing a negative change in our health. One of the first things that you want to make sure you do, if you're struggling with any kind of learning, attention, cognitive difficulty, is making sure that you have the right nutrients to help feed your brain. Omega-3 fatty acids are one of them. Now, a couple of things that I want you to think about when you're searching for what might be the most appropriate one for you. When you're out shopping for omega-3s or fish oil, you want to make sure that you're paying attention to the amount of EPA and the amount of DHA in that supplement, because those are the active ingredients in the fish oil. So you want to make sure that one, you want to make sure you're taking a minimum of 1 gram or 1,000 milligrams of EPA and DHA. So look on your bottle, count the amount of EPA that's in it, count the amount of DHA that's in it, and figure out how much you're going to take to get 1,000 milligrams. Now that's a bare minimum. You take 1,000 milligrams so that we keep the levels in our body normal. But if we're going to really make some changes in our health, changes in our thinking, changes in our memory, our attention, that sort of thing, you're going to need usually somewhere between 2 and 3 grams. So 2,000 and 3,000 milligrams. So take your fish oil, look at the back of that label, and decide how much it's going to take for you to be able to get 2 to 3 grams. If you have to take 20 pills, then that's probably not the most appropriate choice for you. Fish used to be the way that we would get our omega-3 fatty acids. Now, because of some of the issues that we're having in our oceans, the way we've polluted our waterways, we're having a lot of trouble with fish. So if you eat multiple servings of fish every day, there's mercury and other things that can be bad for the brain. So we get this we get our fish oil, our omega-3, from the supplements. Now, if you're really thinking about this, one of the first things you might ask is, so are we still getting the same amount of mercury in the fish oil as we get from the fish? And your answer is possibly, which is why you have to make sure you get a high quality source of fish oil. So if you go to Costco and get the cheapest one, there's a possibility that you're going to end up with the same problem as if you're eating multiple servings of fish every day, and that would be mercury exposure. So in our office, we work with companies that certify everything is pure. So they test the fish oil, and they only use sources that have been tested to be pure, free of any kind of heavy metals and mercury. That is vital to your health, especially when you start taking large doses of 2 to 3 grams or more of that EPA and DHA. So I want you to make sure that you are aware of that very important thing that you want to make sure that you're watching. Now, I thank you for hanging out with me today. In the 19th century, as we had mentioned, those physicians were offended at the idea that they could be the cause of new mothers' deaths. How do you think they're responding now when we suggest that maybe some of the things that they're recommending medication-wise could be making the epidemic of mental illness worse? In the amount of time that it might take the medicine in general to see the truth about our diets, you can already be making a positive change, a positive impact on your diet and on your mental health. Guys, if you want to get serious results, if you want to get serious about your mental health, get serious about nutrition. And I want to offer you, for being on this podcast today, I want to offer you something for free and something that's going to make a difference in your health here. And it is our new guide, 7 Brain Foods You Want to Eat Every Day. Stay tuned whenever you're on our podcasts, whenever you see us on Facebook Live. We're going to start offering some service, some product, something that's going to make a difference for you, that's not going to cost you anything, because my goal is to make sure that we're giving value, that we're providing something that's going to help you and help others. And I ask, in listening to this, if you feel that the information that you get here is something that is good for you, that you feel others should experience, number one, subscribe to the podcast. Just click the subscribe button, and that will allow you to subscribe to the podcast, and then you'll get regular updates from iTunes when our podcast goes live, usually on Fridays. Every once in a while, we may have a bonus stuck in somewhere, but that's something that I'd love for you to that I'd love for you to do is subscribe to the podcast and share this podcast with others. There's a share button if you're in iTunes listening to the podcast. Click that share button and give someone else a chance to experience the information that we provide here. I sure would appreciate that. The last thing I'll ask you to do is, if you're listening in iTunes, leave us a rating and a review. If you appreciate the information that we're providing, I'd sure appreciate maybe 5 stars and just say something nice about the podcast. Now, if the information we're providing isn't very helpful, then certainly don't leave me a 5-star review. I don't want to get anything that we don't deserve, but I sure would appreciate a positive review and feedback of how we are doing. I want this to be something that is going to provide value. I want this to be something that's going to make a difference in your life and in the lives of others. I thank you for listening to us today, and I hope you have a great day. Don't forget, look for our new guide, 7 brain foods that you want to eat every day. It's in the show notes. Click the link that's in the show notes. If you're listening to this on our website, I have a big link that you can just push that button and it will take you right to the spot where you can get those 7 brain foods you want to eat every day. I gave you one of them here. We're talking about those omega-3 fatty acids, and that's super important. Actually, I'll probably put in the show notes too a link for our website on Metagenics. It's one of the nutrition companies that we use, that we love and wholeheartedly trust, and I would give anything here to my mother, my children, anyone that's important to me, because I wholeheartedly trust them, and it's something that I'd wholeheartedly recommend. I'll just leave a link there if you want to find out about the omega-3 fatty acids that they have to offer. Just click that link. It'll take you right to the page of the one that I would recommend the most. And hey, I thank you for joining me. I hope you have a great day, and we'll see you soon. Hey guys, it's Dr. Emil Tompkins. Many people fail to make a change in their health until things are drastic, until we've gone so far that it's so challenging to make that change, or we feel like it's almost too late, and then we're much more reluctant to make those changes in our health. This is a problem, and it needs to change. It needs to stop. When you find something that has an opportunity to make a difference in your health or in the health of someone around you, I invite you to take that opportunity to make that change for yourself or for someone you know. So I have a favor to ask of you. If you've listened to this podcast and you feel like there's something here that you think will benefit someone that you know, I invite you to share that podcast with them. There's a share link on the bottom of the screen. I want you to click that share button to share this with others. Give others the opportunity to experience the Beyond Pain Relief podcast. Share that with others. Make a difference in the health of someone around you. And I thank you so much for doing that. This is Dr. Emil Tompkins. Thank you for joining us on the Beyond Pain Relief podcast. And thank you for making a difference in the lives of the people around you. Have a great day.
You are listening to the Beyond the Pain podcast, where Dr. Emil Tompkins and his guests guide you through the latest techniques to relieve your pain and learn how to fuel, move, and think for lifetime wellness.